Hello everyone, my name is Kristen Mapachuk and I am a Master's of Social Work student at Grand Valley State University. I am in my last and final semester here at Grand Valley and I chose to do my capstone project on play therapy. Play therapy is an evidence-based counseling intervention appropriate for the use in elementary school settings to address the mental health needs of youth, as well in counseling settings for children and adolescents, and can even be used with adults. The main use of play therapy is to treat a wide array of emotional and mental health and behavioral problems. For this specific play therapy capstone project, I chose to research 3 articles regarding play therapy and then interview 2 licensed clinicians who practice play therapy within their office. The 3 articles that I chose to research were an examination of child-centered play therapy and synergic play therapy. The next is effectiveness of play therapy in enhancing psychosocial outcomes in children with chronic illnesses, a systematic review, and the last is utilizing play therapy within ASCA national model. The ASCA national model is the accreditation platform that you are under once you become a registered play therapist. Within the article that explained child-centered play therapy versus synergic play therapy, I also asked the clinicians what therapy theory they most often use and to ask their reasons why. Child-centered play therapy is where the child kind of leads the play therapy session and the play therapist then evaluates and picks up on what things are causing the child to be deregulated or what is stemming from their behavioral concerns. Whereas the other model is still child-led, but it is without boundaries. So the child is pretty much free to do whatever they would like in the playroom, and the therapist then also just kind of watches and sees what the child does. When I interviewed both clinicians, the first clinician that I interviewed was Miss Diana from Roots, and I asked her various questions, and one of which being what type of play therapy does she practice. And oftentimes she said that she believes in play therapy that is child-centered because it allows the child to run the show but have boundaries with it. With child-centered play therapy, the clinician is running the session, but the child still is able to be directed and play in a way that they would like to play and kind of play freely. So that is a better way for the child to intervene and to allow the clinician to look upon the child and see what is going on underneath. Within the child-centered play therapy, it's recognizing the current capacity of the child and incorporating treatment with everything that the child does. So it depends on where they are developmentally to really create that treatment plan that is centered around them to help with whatever they are struggling with. When I was interviewing Diana, I asked if you really needed to be certified or registered within player therapy to actually practice it as a clinician. And her response was, you don't need to be registered or certified, you can just be trained. So for her personally, she is trained within play therapy. And there are many different resources where you can get trained. Some of them were the Michigan Association for Play Therapy. She also mentioned that PESI offers training for play therapy, as well as some universities offer catalogs that you can look into to see if they offer any in-person play therapy trainings. There is a large training in Chicago that offers in-person 3-day training on play therapy. I did ask what the certification process looks like if you did decide to become a registered play therapist, and it's quite a process. You have to complete so many hours in order to be considered a registered play therapist, and you need to practice underneath a current registered play therapist to be able to be fully registered and accredited. And the next question I asked her was, how do you engage with a child during their first session? So in her instance, she owns her own business, so she has the first meeting is more of a meet and greet and to assess the child developmentally to see where they're at with that, and then to see what struggles they are having. She also mentions that she met with the parents to go over what their views are about the child and what they see as a problem. And then she does a assessment that goes over what has been in their past. She calls it the Function Developmental Capacities Test. And in her case, she mostly sees children who are emotionally dysregulated. With knowing that the majority of her clientele that she sees are children who are emotionally dysregulated, I then asked what the population of children she does see and kind of what their diagnoses are, if there's any other sort of dysregulation that could be going on that she sees. And she said she mostly sees the children who have gone through play therapy before and it hasn't worked, and she does more intensive play therapy, and she really listens to where the child is at, especially focusing on their developmental capabilities and capacities, and that is when she is able to form a treatment plan that is best fit for that child. Her sessions are only about 40 minutes with the children, and she incorporates the parents towards the end of the session to help them understand what they are working on during the session and how they can incorporate that at home. The next person I decided to interview was Helen from the Downtown Foundation for Child Development and Counseling Center. And she is a trained play therapist, and she is not certified or registered as a play therapist, but she is trained. And I asked her a few of the same questions as I did Diana. I asked her why she decided to just be trained instead of becoming a certified registered play therapist. And her response was she didn't want her full priority to be play therapy. She also wanted to be trained in other aspects of therapy so she could be a better, well-rounded therapist if there were to come a child who is in need of other services other than just play therapy. She wanted to be able to offer those services as well. I asked her what her thoughts were on the certification process, and she directed me towards another therapist within the community who is a registered play therapist to kind of get her insights on how to become registered, as she is not that familiar with the process. So that's what I decided to do. I then asked her what type of play therapy she practiced, the child-centered or the generic, and she stated that she doesn't follow under either of those practices. She stated that her therapy is centered around the child based on the age and their interests, and then she joins in them. She stated that she lets them play and notices behaviors and then asks questions based off of those behaviors. She asks the child why they are doing that behavior, or what is kind of going through their mind while playing, and then she kind of narrows it down to see where exactly the problem is stemming from. Helen emphasized greatly on the need to incorporating the child's parents, because ultimately they are the person who is bringing their child for therapy and seeing the problems that are occurring. She said that you could just look at the child and observe the child to figure out what's going on, but it's really the parents that help shape the therapy treatments, what will work within their household, and really what is best for their child. She also stated that she gets information from the children and parents. If the child isn't very talkative or shy, she goes to the parents and asks them if their child has any specific interests, and if they do, she kind of goes into that session already knowing what the child likes, and for an icebreaker she can bring up that interest to help relax the child and help them engage and kind of open up to her. In Helen's case, when I asked about what types of children she sees and their diagnoses, and she said she also sees a wide variety of children with many different diagnoses. She said she has seen children that have traumatic brain injuries, or just have depression, anxiety, social anxiety, nervousness about school or school problems. She also sees children who are afraid to be in public and or just don't like to be around people. So she kind of works with them and creates a treatment plan based around what is going on within their life to help them grow and break down those barriers that they're currently experiencing. When I asked how she engages with the child on the first meeting, it goes back to having that small interview with the parents to figure out what the child's interests are and what's going on at home to really understand and know what the best approach is to meet the child's needs during that first meeting. She said that it is very helpful to know what the child's interests are to help break the ice and engage with them. And then she went off to say that it's really important just to be an overall well-rounded therapist in general. She said some kids don't like to play with toys and they like to do homeworks or workbooks, or they like to draw to express their feelings. So she emphasized not all of the therapy within play therapy needs to be playing with toys. And that was really helpful to know, because my understanding around play therapy was just with the use of toys. After interviewing both women about play therapy, I also did some research on what types of things are found in a play therapy room. And I found that it is important to have generic toys within the playroom, because if the child, for instance, sees Elsa from Frozen, they will oftentimes act like Elsa from Frozen and not really expressing their true inner feelings and emotions. As well as a superhero like Batman, they'll play out what Batman is like and not expressing their true feelings. So I thought that was very important to know that getting a character toy isn't the best option to have in a play therapy room. I also learned that sand tray therapy is very helpful with kids who have sensory issues or just aren't sure how to go about playing, and the sand is a helpful regulation tool. And in most play therapy rooms, they have it set up where all of the toys are standing up on shelves, so the child has clear vision of what all options they have. And in some cases, children are more geared towards animals instead of people figures, which I also thought was interesting. And with play therapy and sand tray, they use what is called miniatures. So all of their toys are very small, and they are almost the size of the little green army men. And this helps to kind of get their imagination going and to play out what's going on. I also found that other forms of toys are helpful for kids, such as like doll houses or castles, and even having toys that represent the doctor, the dentist, or school, because some children may have trauma from going to the doctor or going to the dentist, and having those sort of toys within the playroom allows for the child to get familiar with the toys, with the tools that the doctor uses, and that gives the therapist an opportunity to kind of explain all of this to the child. Another thing within play therapy that is important is blocks and Legos. This allows the child to build structures and build scenes of different things that they have experienced in their life that may cause trauma or emotional dysregulation, and the therapist then can recognize what's going on and really tweak that into their treatment plan. Throughout this whole Capstone project, it was very important for me to realize that play therapy isn't just about playing with toys with kids and having fun and, just playing with toys. It really is about the child and fine-tuning where they struggle and how to use play as a coping mechanism for them. I plan to be trained in play therapy and practice this as a clinician myself, and doing this research behind play therapy, the theories behind it, the different theories used within the therapy, and to also find out from different clinicians what theory is best to use in their opinion. It was helpful to understand that one therapy clinician prefers one theory and the other prefers the other. So it just kind of depends on your personal preference. They both are backed up by research, and it's really up to the clinician to decipher what theory they best connect with and can practice within. I also found that it was important to understand and incorporate the families within play therapy. It's important to have the child alone to do play therapy, but getting a better understanding from the parents about the child was essential. So throughout this whole process, I learned a lot, and I'm very excited to use what I learned within this research within my own practice as a therapist in the future.